Hello everyone, my name is Savannah Lynch and today we will be discussing fall prevention measures. This is for Group 6 with Emily, Joynt, Kesheena, Troy, and myself for Nursing 321, Gerontological Nursing and End-of-Life Care with Ms. Cunningham. Falls in older adults are a common occurrence related to many risk factors. They are a major public health concern as they have severe adverse reactions such as death, fracture, psychological distress, and economic burden. The geriatric population is at increased risk for falls related to medications, urinary incontinence, alcohol consumption, comorbidities like COPD and hypertension, frailty syndrome, or mobility impairment. Moving forward, preventing falls and initiating fall prevention measures should be standard practice to alleviate risk for injury. The geriatric population is the most common to suffer from a fall. 10% of older adults have suffered from a fall in the last 3 months. 1.7 million suffered an injury, and 875,000 went for medical treatment for such injuries. There are both modifiable and non-modifiable risk factors placing this population at an increased risk. The key to understanding why falls occur is understanding the causes of falls. There are both modifiable and non-modifiable risk factors placing patients at risk. Let's discuss the modifiable risk factors. Drugs. The use of 4 or more medications raises the risk of falls. Benzodiazepines can raise the risk of night falls by 44%. Solitary lifestyle. Living alone places a patient at risk for falling and remaining on the floor. A sedentary lifestyle. This leads to immobility and deconditioning. Poor nutrition. Low body mass index and decreased vitamin D results in impaired gait problems. Let's discuss some non-modifiable risk factors. Age. As we age, our reaction time decreases, which increases our risk of falling. Gender. Women are more susceptible than men to falling. Race. Caucasian people fall more often than other ethnicities. Comorbid conditions like vascular disease, arthritis, diabetes, COPD, hypertension, vertigo, and incontinence increase our risk. Cognitive disorders like dementia and poor memory, impaired vision from things like glaucoma, cataracts, or just decreased field of vision are correlated with falling. Many patients experience repeat falls once they've already had one fall. Up to 70% of patients who've experienced a fall report a fear of falling. 50% may decrease their physical or social activities because of this fear, putting them at a higher risk of falling or other geriatric syndromes. Falling in the elderly population is a universal problem. Annually, roughly 14 million older adults report a fall, with 37% requiring medical treatment. Falls are the second leading unintentional injury-associated cause of death. Over time, the percentage of falls resulting in injuries reported has increased within both community and healthcare settings. Many falls result in intracranial injuries and fractures. A lot of these fractures are pelvic fractures and lower extremity fractures, and these patients often have longer hospital stays, averaging 18.8 days, with a higher associated morbidity and mortality. The outcome of a fall is correlated more with frailty of that person rather than strictly their age. However, frailty is commonly associated with aging. Frailty can be related to decreased mobility, improper nutrition, vitamin D deficiency, or hormonal imbalances. Falling is often a repeating problem. After already suffering from a fall, many assume that they're going to fall again. And this anxiety increases the risk of falling even more due to the increased risk of developing weakness, pneumonia, pressure ulcers, and immobility. This anxiety forms a cycle, setting elderly patients up for just continuing to fall repeatedly. Falls are a systemic problem. Preventing inpatient falls often comes from increased patient education and proper rounding. By increasing the intensity and the time spent on educating patients on the risks and preventative measures to reduce falls, we can notice a sharp decline in the occurrence of falls. Now, this directly coincides with safe nurse-to-patient ratios regarding these inpatient falls. Most states do not have mandated staffing ratios. However, California has legal limits for the number of patients that a nurse can have, which has led to a decrease in falls and a decrease in overall morbidity and mortality for these patients. Many fall prevention methods have been tested and developed to aid with the worldwide issue of falls in older adults. While studies have continued, falls have remained a serious issue in the elderly community. Efforts to reduce falls with the assistance of a digital platform for nurses had little impact overall, but may require further studies. Let's discuss some best practice recommendations for nurses. Utilization of our hospital's guidelines for identifying high-risk patients. Integrated prevention methods of bed or chair alarms. Utilizing bedside sitters. Increased patient rounding. Patient and family education. Non-slip socks. And, if deemed necessary, physical restraints. There are multiple assessment tools and strategies that nurses can use to identify these high-risk patients, like the Barthel Index, National Health Commission Fall Scale, Hoxsey Fall Risk Assessment Scale for adults, the Morse Fall Scale, and the Berg Balance Scale. Proper identification of high-risk patients can help the nurse initiate proper prevention methods for these patients. Let's discuss the impact for nursing. In order to prevent these falls, it is vital that nurses implement fall risk prevention strategies, communicate with other members of the interdisciplinary team, create individualized care plans for these patient needs, assist in caring for the activities of daily living needs, assess daily changes in medication and patient needs, and provide a safe environment for the patient. Increasing compliance with implementing best practice prevention methods can decrease the number of falls within the elderly population. Decreasing the risk of patient falls not only helps the patient, but can also decrease the cost of hospital burden that occurs with repeat hospitalization. In conclusion, falls are a common risk within the geriatric population. Identifying patients at high risk for falls is key to properly preventing harm to these patients, and decreasing falls helps to alleviate risks, including death, fracture, and increased hospital stays.